Hi, I'm Dr. Christopher Coroneos, an assistant professor in the Division of Plastic Surgery and Department of HEI here at McMaster University. On behalf of Dr. Offodile and all of our co-authors, I'd like to thank JAX for the opportunity to share our research on the relationship between financial toxicity and quality of life in women undergoing surgery for breast cancer. I'll turn it over to Dr. Brian Chin, one of our residents and graduate of the Surgeon Scientist program, to get us started.
Thanks, Dr. Coroneos. Breast cancer is the most common malignancy among women in the United States and accounts for the highest overall cancer spending. Even for patients with insurance, deductibles, co-payments, and premiums can quickly lead to high out-of-pocket expenses. Approximately 1 in 3 breast cancer patients experience cost-associated distress related to treatment. This financial harm is called financial toxicity. We know that financial toxicity impacts patients as it influences their decision-making on cancer treatments. Patients experiencing financial toxicity have worse oncologic outcomes. So we designed a study to analyze the association between financial toxicity and quality of life outcomes among insured women undergoing breast cancer surgery in the United States. This is the first study to analyze this relationship. This was a retrospective study of breast cancer patients undergoing lumpectomy or mastectomy with or without reconstruction between January 2018 and June 2019 at MD Anderson Cancer Center. Eligible patients completed 3 validated questionnaires. The comprehensive score for financial toxicity, or COST, was used to measure financial toxicity. BreastQ and SF12 were used to measure condition-specific and general quality of life. A regression model was used to analyze the association between cost scale and quality of life outcomes. Overall, financial toxicity is moderately correlated with mental and physical quality of life measures. Greater financial toxicity was associated with worse scores for breast-related psychosocial well-being and satisfaction with reconstructed breasts. What is interesting is that financial toxicity has the largest impact on psychosocial well-being of patients measured by BreastQ, with a near one-to-one relationship with the cost scale.
Only once we understand the financial pressures patients are under can we begin to help them tailor decisions for their care plan. Breast cancer patients are expected to make a number of decisions at the same time, which I believe makes breast cancer a unique condition. Patients decide in many cases on lumpectomy or mastectomy, chemotherapy and radiation treatments, the spectrum of reconstructive options, and the impact of treatment on their fertility. All of this comes on the background of high out-of-pocket expenses. There are many factors that are sensitive to patient preferences. What our study demonstrates is the need to consider the financial burden of each of these decisions and how it directly impacts the patient's quality of life. Moving forward, we hope our study stimulates changes at the institutional level as well. The added financial burden of transportation for medical care, missed days of work, childcare, these cumulative costs can be very expensive. Optimizing a care plan to minimize the financial burden, such as coordinating treatments or minimizing the need for travel, can have a real impact on improving quality of life in our patient population. In the future, we also have to be able to identify patients with a high financial risk early and advocate for these at-risk populations at our own institutional levels. On behalf of myself, Dr. Brian Chin, Dr. Offodile, and the rest of our co-authors, thanks for listening. Thanks for reading.